My name's David McIntosh, and I'd like to take the opportunity to talk about ADHD and the context with which that relates to ear, nose and throat as my specialty. Just a little bit of background regarding me. I am an ear, nose and throat specialist. I have a special interest in paediatric ear, nose and throat conditions, also interested in nose and sinus disease and in particular upper airway obstruction. For those that may be interested in further professional advice, the contact details are as they appear on your screen. It should be noted that this conversation and discussion is purely for education purposes and in no way constitutes personal or professional advice. So, ADHD, what's the story? Well, ADHD stands for Attention Deficit Hyperactivity Disorder, and the term actually covers quite a wide range of different types of behaviour in children. And we have well-defined criteria that are used to determine whether a child has some form of ADHD, and we basically divide these criteria into two: inattention and hyperactivity. And I'm going to go through the criteria in the next few slides that break down ADHD into its components, and then I'll talk about sleep-disordered breathing and also something called auditory processing disorder. So, looking at the ADHD criteria, in the context of inattention, we're looking for 6 or more symptoms in kids up to the age of 16 or 5 or more 17 and beyond, and they have to have been there for at least 6 months. So the criteria there is failing to give close attention to details or makes careless mistakes in their schoolwork or if they're at work or other activities, trouble holding attention on tasks or play, does not seem to listen when spoken to directly, does not follow through on instructions, fails to finish schoolwork, chores, duties in the workplace, trouble organising tasks and activities. Avoids or dislikes or is reluctant to do tasks that require a bit of mental effort, such as schoolwork or homework, for example. Loses things necessary for tasks and activities, such as their pencils, books, etc. Easily distracted and often forgetful in their daily activities. We also look at the hyperactivity and what we call impulsivity criteria, and again it's the same thing: 6 or more in kids up to 16 or 5 or more in those 17 and beyond, and again at least 6 months, and it must be to an extent that it's disruptive and inappropriate. So such as fidgeting or tapping of the hands and feet or squirming in their seat, leaves their seat in situations when they're expected to be sitting down, runs or climbs about when they should not be doing so, unable to play or take part in activities of leisure in a quiet way. They often describe to kids always on the go, as if they've got a motor that just will not stop. They may talk excessively, blurt out answers before a question has been completed, trouble waiting their turn, and interruptions. Get that out of the way for you. Interruptions or intrudes on others, butting into conversations or games, for example. So, in addition to that, the following conditions must be met. So, several inattentive or hyperactive impulse symptoms before the age of 12. Symptoms present in 2 or more settings, so for example at home and school or work, friends and relatives places and so forth. Clear evidence that symptoms interfere with their level of functioning, and they do not happen only during the course of certain other mental health conditions at the same time. And when we put this all together, we end up with 3 types of ADHD. We have a combined presentation, which is if symptoms of both criteria for inattention and hyperactivity are present. Predominantly inattentive presentation, where it's more in that first group of criteria that we looked at, and then predominantly hyperactivity and impulse presentation. And again, it's important to realise that the symptoms can change over time, so their presentation may change in that case as well. Now, when it comes to sleep, sleep is a basic necessity. It's the quality of sleep that's more important than the quantity, so I often say to parents 4 good hours is better than 12 bad hours. The most common sleep disturbance of children is an impairment in their ability to breathe at night, and we call this sleep-disordered breathing. 2 most common manifestations are snoring and mouth breathing. Both of these are indicative of some form of airway obstruction, And having an airway that is partly blocked is not a good thing, especially in children. So what do we know about sleep and ADHD? Well, we know that sleep complaints in children with ADHD have been reported in up to 55% of cases. Around 25% of all children experience some form of sleep problem, and around 12% present with snoring and sleep apnea in that context. So it's important for children undergoing evaluation for ADHD to be routinely screened for sleep problems. Because if there's a misdiagnosis of ADHD, this can be problematic, especially when you bring into account that medication, such as the stimulants for ADHD, can cause insomnias. So that only adds to the sleep problems. What's interesting is that in some countries you cannot prescribe medication for ADHD until their breathing at night's actually been formally assessed, which I think is a good thing. And sometimes people don't appreciate the fact that snoring is a problem. Dad snores, kids snores like them. The important thing is children are not mini adults. Snoring is a noise that is made because there is a blockage to the breathing. So if, for example, someone was coming into your child's room at night and choking them, you wouldn't put up with that for very long. These children are choking on the inside. They're choking on their own problems. So again, it's not something that you should be putting up with or dismissing. And when it comes to children, they're not mini adults, and the causes of sleep disorders is quite complex, and you need to look at factors that are specific to children that may not necessarily be relevant in adults. Things such as a small skeletal structure, craniofacial malformations, impaired nerve and muscle tone, large lymphoid tissue, that's your tonsils and your adenoids, allergies and hay fever causing a blocked nose because of the swelling that it induces, and even just impaired brain function in terms of the nerve responses to altered arousal thresholds. The other thing is that with the growing obesity epidemic, it contributes to the prevalence of sleep apnea in older children and adolescents too. So if there's one take-home message, it's not okay for kids to snore, and it's actually really bad for them. Let's look at a bit of science. So in the paper listed here, published in 2014, they wanted to look at the relationship between sleep-disordered breathing and ADHD symptoms, and whether surgery makes a difference. And they found that there was a medium relationship between ADHD symptoms and sleep-disordered breathing. And they found 12 studies where they looked at pre- and post-surgical ADHD symptoms, and the results suggested a medium level of effect, whereby adenotonsillectomy was associated with decreased ADHD symptoms as soon as 2 months, stretching out for well over a year. This paper, published in 2012, was a really important paper because they looked at sleep disorders and how they may contribute to behaviours that resemble ADHD. And they did so by looking at 11,000 children over a period of 6 or 7 years, beginning at 6 months of age. And they looked at children suffering from sleep-disordered breathing, which includes snoring, breathing through the mouth, and sleep apnea. And they had a higher incidence of behavioural and emotional issues such as hyperactivity, aggressiveness, depression, and anxiety in these children. In fact, it was 50 to 90% more likely to develop ADHD-like symptoms than were normal breathing children. And the children that suffered most from these sleep disorder breathing behaviours at the age of 2.5 had the highest risk for hyperactivity. So a very young age with things going wrong with the breathing led to hyperactivity. And a lack of sleep can damage the brain, particularly in parts of the brain that control behaviour. And one thing that we now know is that a disruption in sleep affects the brain such that it can result in inattentive behaviours, hyperactivity and impulsivity. All those things listed in the criteria for ADHD. So when ADHD is suspected in a child, nighttime sleep patterns really should be reviewed, and a sleep specialist, an ENT specialist, really should be obtained in such situations. What else do we know? Well, we know that this isn't new information. If we go back to 2003, they looked at a study here looking at 3,000 children who were 5 years of age, and they got the parents to basically ask about snoring and other sleep disorder breathing symptoms, and just indicate if there are any problems with being tired during the day or problems with their behaviour. And when they looked at these children, the parents were reporting hyperactivity in about 20% of these children. Inattentive behaviours about the same. Often children had other things going on. 10% of kids were showing aggressive behaviours. 10% were tired during the day. Overall, sleep-disordered breathing symptoms were present in 25% of these children, and this was just a random population survey. When they compared children without snoring or other symptoms of sleep-disordered breathing, the children with the sleep-disordered breathing were significantly more likely to have daytime sleepiness, problem behaviours, hyperactivity, inattention, and aggressiveness. In fact, the rate was about twice the rate of kids who had no problems with their breathing at night. So similar to the other results. So essentially, sleep-disordered breathing problems are quite common in children, even at the age of 5, and increased risk of being tired during the day and problems with their behaviour, which is suggestive of ADHD. What about hay fever and allergy? Again, this is not new knowledge. Just to clarify some terminology, allergic rhinitis is the medical term for what people would generally refer to as hay fever. And they wanted to know how often kids with a diagnosis of ADHD had hay fever. So they looked at children between 5 to 18 years of age who've been given the diagnosis of ADHD, and they tested them for allergies. What they found, 80% of those with ADHD reported hay fever symptoms, and 61% had at least one positive test result for an allergy. 43% showed physical signs of allergy, and all of them had a positive family history for allergies, and 53% had other forms of disorders. So we know that hay fever ties in with things like eczema and asthma, for example. Most children with ADHD displayed symptoms, and skin prick test results were consistent with allergies. So long story short, nasal obstruction and other symptoms of allergic rhinitis may explain some of the brain, which is cognitive patterns observed in ADHD, and that may be because of the sleep disturbance known to occur with allergic rhinitis. So it's not just about tonsils and adenoids, just hay fever and allergy in children with ADHD diagnoses needs to be considered and assessed for. Then someone decided eventually to take that 2004 paper a step further and actually look at what happens to children with ADHD diagnoses if we go and treat the hay fever. So guess what? The children with so-called ADHD who had the hay fever, when that hay fever was treated, their ADHD symptoms improved. So what do you need to be on the lookout as a parent? Well, these things are bad. Children that sleep in an unusual position, especially with their head off the bed or propped up with many pillows, that's not normal. If they're snoring loud and often, that's not good. If they stop breathing for short periods during the night, that's not good. Any signs of snorting, gasping, or even just waking up after a pause in their breathing is an indication that something needs to be looked for. They may sweat heavily during sleep, and then they have the behaviour problems at school, daycare, or at home, and their sleep is quite restless. They might be difficult to wake up in the morning after what would be otherwise a long night of sleep. They may have headaches during the day, particularly if it's in the morning. If they're grumpy or aggressive or simply cranky, either in the morning or through the day. Falling asleep or so-called daydreaming at school or at home. Not outgrown bedwetting at a typical age. Sleeping with their mouth open, grinding their teeth at night. You can add sleepwalking, sleep talking, night terrors to that list as well. What about children that snore that don't have the features of ADHD? Well, again, more than 25% of all children, not just those with so-called ADHD, will have a sleep disorder at some point. These sleep disorders may have an enormous and varying impact on family dynamics, school success, and other health issues. It can affect not only their brain, which we've been talking about in the context of ADHD, but their heart, their blood pressure, their growth, their appetite, maybe their teeth and jaw development, and so many other things. So every parent should review the checklist of things to watch out for, and if you find them, do not take no for an answer. Insist on seeing a pediatric ENT specialist that knows about sleep disordered breathing. But it doesn't end there. Another condition to be aware of is something called an auditory processing disorder. This is a situation where children can hear perfectly fine, but they have trouble understanding what is being said, especially when there's background noise. The consequences of this is they come across as being inattentive, and they actually fulfill 5 of the criteria of inattentive ADHD list automatically. When you look at the criteria for diagnosing an auditory processing disorder clinically and ADHD clinically, 5 of those ADHD criteria are there already. And if you recall that they had to get 5 over the age of 17 or 6 before the age of 16, these children are sitting on the fence just waiting for one more thing. So the problem is that these children will have a standard hearing test which they pass because their hearing is absolutely fine. It's their listening that is the problem. And it may not be until they see a pediatric ENT specialist or someone well attuned with respect to auditory processing disorder that the diagnosis is entertained and a special test called a CAP test is organised. And these children, again, don't need drugs to help them concentrate. They need special listening devices, in particular something called an FM system. And there's a clinic which I'm associated with financially called Attune, and you can learn more about central auditory processing tests, which is what CAP stands for, at the website listed there, attune.com.au. So again, these are just my details. I hope this mini talk has been helpful just to plant the seed in parents' minds and also the medical profession's minds regarding ADHD and the broader issue of how sleep is interrelated with the diagnosis. And it doesn't just stop at ADHD. You can look at Asperger's, you can look at autism, you can look at sensory processing disorders, a whole range of conditions. There is something going on with the breathing of the child at night that can interfere with their brain function and manifest in so many different ways. Thank you for your time. I hope this has been very helpful for you.